Ayurveda was recorded more than 5,000 years ago in Sanskrit in four sacred texts called the Vedas: the Rigveda, Yajurveda, Samaveda, and Atharvaveda. Ayurveda claims to treat a range of disorders like asthma, anxiety, digestive problems, etc. So, in order to gain knowledge about Ayurvedic science, our institution has arranged a webinar on importance of Ayurvedic science and its career options in post-COVID era by Dr. Prathima Nagesh, doctor in UK and lecturer since 14 years at different institutions of European countries. I kindly request our principal to welcome the chief guest. Over to you, sir.
Okay, thank you. Dear students, and also today's chief guest. This is a third webinar program we are conducting in this year. Already we did two programs. Last week, our old student, Mr. Madhurupadhyay, has conducted a program, and this week, one more student of Viveka institution. Presently, she is working as a doctor at London, UK. Dr. Prathima Nagesh, and she was my student also, my proud student, and she had completed high school as well as PU in our institution. 3 years girls high school, Viveka girls high school, and 2 years in Viveka PU college. And she had completed a degree BMS in SDM Udyavara, and she had completed MD in Panchakarma in SDM college Hassan, and presently she is working as a doctor at London and running 2 clinics, as well as she is working as a lecturer since 14 years in Middlesex University, England, and giving a guest lecture to different institutions. So one of them in Belgium also. So wonderful achievement by her. She came from Kannada medium and achieved a lot. So this one inspires to our students. So by hard work, dedication, vision, so one can achieve anything. One can reach the goal by hard work, and also vision should be there. And one more thing, last year she had completed post-graduation in Harvard Medical School, UK. Presently, she is so multi-talented person, and now she is the director of Ahimsa Ayurvedic Center, Paris. ಈ ರೀತಿಯಲ್ಲಿ ಹಲವು ಪ್ರತಿಭೆ ಅವಳ ಹತ್ರ ಪ್ರತಿಮನ ಡಾಕ್ಟರ್ ಪ್ರತಿಮಾ ಇವರ ಹತ್ರ ಇದೆ. ಒಂದು ಹಾರ್ಡ್ ವರ್ಕ್ ಇಂದ ಮಾಡ್ಬೇಕನ್ನುವಂತ ಛಲದಿಂದ ಏನನ್ನು ಸಾಧಿಸ್ಲಿಕ್ಕೆ ಸಾಧ್ಯ ಅನ್ನೋದಕ್ಕೆ ಜ್ವಲಂತ ಉದಾಹರಣೆ ಪ್ರತಿಮಾ ಅವರಾಗಿರ್ತಾರೆ. ಅವರ ಅನುಭವ ಮತ್ತೆ ಇವಾಗಲೇ ಹೇಳಿದಾಗೆ ಇಂಪಾರ್ಟೆನ್ಸ್ ಆಫ್ ಆಯುರ್ವೇದಿಕ್ ಸೈನ್ಸ್ ಎಸ್ಪೆಷಲಿ ಇನ್ ಪೋಸ್ಟ್ ಕೋವಿಡ್ ಏರಾ ಇದರ ಬಗ್ಗೆ ಮಾತಾಡ್ಲಿಕ್ಕಿದ್ದಾರೆ. ಆನ್ ಬಿಹಾಫ್ ಆಫ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂಡ್ ಸ್ಟಾಫ್ ಐ ವೆಲ್ಕಮ್ ಡಾಕ್ಟರ್ ಪ್ರತಿಮಾ, ಅಂಡ್ she has to spend her precious time, about 1 hour nearly, so with us. So I thank her regarding this, and I extend my special thanks to one more my student and my friend also, Mr. Sanat Kumar Udupa. Now presently he is working as a software engineer at Bangalore. So technical assistance by Mr. Sanat Kumar Udupa, and also he is supporting us in different way, even frequently donating the funds to our institution also. And so So the entire program, so assisted by our computer department, Mr. Sitramaya as well as Mr. Srikant Chadaga sir. So thanks to them also. So now directly, dear students, if you have any doubts regarding the subject, career options in Ayurvedic science, you can chat with our guest in the later part of this session. Directly over to Dr. Prathima. Thank you.
Thank you, sir. Good morning, everyone. Just a minute.
Yeah, we can see. Correct. No problem.
Yeah.
Go ahead.
Can you see that? Can you see my screen?
Yeah. Everything is visible. Correct. ಎಲ್ಲವೂ ಕಾಣಿಸ್ತಾ ಇದೆ. Importance of Ayurvedic science.
Okay, that's fine. Thank you.
Thank you.
Yeah. Good morning, everyone. Good afternoon also for you guys. You are in India. Yes, today I'm going to talk about importance of Ayurvedic science and career options in post-COVID era. This is actually the topic given to me, and all my teachers, everybody knows that usually I'm one of those students who doesn't stick to the protocol as told always. So after talking to Sanat, I changed a little bit of the contents, and I thought I'll share how was my journey from VJC to where I am today. I thought I'll share a few points about it, how VJC helped me to what particular aspects I spent in VJC helped me to be what I am today, also with you guys. So a few slides on that before. So before going to everything, what is success? The dictionary definition of success is completing a dream or a task. That is success with a good outcome. That's what it is called, success. So what is being successful? Being successful means achievement of desired visions and planned goals. So this success is different for a different individual. Remember, what goal you keep, so you feel you are successful once you reach there. So when I started the schooling, of course, my schooling was in Kannada medium till 10th standard. Then I jumped into English medium, just like most of you might be doing now. And the same way kind of thing. At that time, in the PUC, all I had thought was I wanted to be an Ayurveda doctor. That's what my aim was. I didn't have much more aim there. So I would have finished that once I finished BMS, and that's it. But I have to tell you a small story on the side here. When I was maybe 19 years old, around that time, I was having a chat with one of the family friend who is a pioneer in a lot of medical surgeries in India. I was talking to him, and he told me something. You have to dream of reaching some few floors, whatever you think, whatever the number of floors. Then you have to keep on climbing the ladder slowly. That's what he said. And I immediately asked him, then if you would have dreamt that the 10th floor, you have already in the 10th floor, isn't it? He told me definitely no. If you dream of 10 floors, then you can only be able to reach at the 2nd, 3rd or 5th floor at the maximum. Because life, of course, for the young kids like most of you guys, life is a different thing. As you pass on in the life, you see that, yes, it is not that easy. You dream something, you catch the dream so smoothly. That's not going to happen. But the persistency, that we have to keep on doing that. And after that, I had one other thing, because whatever you think is, your best competitor is yourself. Remember that. Always look for the better you. It might be in the personality or your humanity values or your career or you as a wife, husband, a daughter, mom, whatever it is, like that. So, or friend, all these things. How can you make yourself better? That's how we have to think. So that's why the success is different in everyone's definition. Remember that. So you have to keep a goal, work on that. That's what I want to start with for you guys. Coming to a little bit about my story. These are the pictures, the comic pictures you can think of me as. Of course, in the VJC, I was like this. A little bit change is I never had two plaits. It's just a single jade, one udda jade, full hand, one kai tumba bale. That was me in the VJC. Of course, what I used to do in the girls' high school and the VJC is one thing. I always look for the opportunity to talk. One thing I knew, what I can do best is to talk. So I have to thanks to quite a few teachers shaped me in the way how I am talking. And every time with the international platforms, people come and tell me you are doing your talk was really good. I have to say that these certain ways of how to talk and all these things I learned in the VJC. I will never ever forget the days in the girls' high school where we used to give topics to, especially Shripati Hele sir and Gumsha Madige sir. We used to give topics to see how they talk, and then they will give us topics to see how we talk and changes. Why I'm saying this is, of course, we are always focused on, I want to read. I know, but it's always the best thing to have a kind of extracurricular activity, whichever you are interested in. That shapes you a lot. It might help, like, for example, if you are in a cricket team, football team, any of this, that helps you with your team playing abilities. That helps you with your interpersonal relationships. That indirectly, that point helps you in your CV when you are applying for the job further also. Okay. So these things I would suggest. If you're good in singing, yes, you never know, singing can be turned into your career also some point of time, or just a side career. Or if you're good at painting, yes, that can be not only just relaxing, you can adopt it into your career some point of time also. So whatever at least one extracurricular activity, keep on doing it. That is very important for your growth. And from here, I did a BMS, and halfway through the BMS, I realized that I'm not the person who has going to stay just as the BMS and sit down. I do want to study further. I want to do MD. I realized that almost somewhere around the final year, maybe. This is where my dream chasing ability changed there. I upgraded my dream to, okay, I have to finish my MD. But only one thing is, you remember, from the PUC till I finished my BMS, all I used to do is, my main target was to hard work and study and apply what I have studied. So that is being very helpful as in my career now. Whatever you guys take, that's another thing I want to tell you. Whatever you guys take, you can be an engineer or a doctor or a nurse or a MBA or a chartered accountant. Whatever you do, the early years of the study, you put your 100% into it, so that you know the knowledge, you have the knowledge. The language you don't know, don't worry. You will learn the language. It's a means of communication. It's just wherever you go, you can pick up the language from there. That is just a means of communication. By being with people, you can achieve that some point of time. But when you are studying, give your 100% to what you are attaining, that particular knowledge. It's not just getting the scores which is desired for the passing the exam. It is also about how much in-depth knowledge you have. So once you get into any of the professional colleges, start giving your 100% and start studying as deep as possible. So I did my MD. At that time, I changed my dream, because at that time for me being successful might be writing a UPSC, get into one of the government sector jobs. I wasn't sure because of people who know me know that because of my height, I definitely can't go for the certain civil services. So I have to get into UPSC and get in the side of the Ayurveda. That was my dream. Okay. And when I was doing MD, I met my husband, and of course, he was in UK. I thought I was just thinking about it, whether to. Of course, one thing I had is uh, um, I never wanted to leave Ayurveda because I studied it with 100% passion. It wasn't that my parents said you go and I studied. It was what I chose to study and studied with full passion, and I never wanted to leave this work. And I knew there is some opportunity in the UK. So I was, when I finished my MD, this is how I was. Again, a very, very traditional Indian girl. Okay. Then this is what I am now. A little bit change here. I couldn't get the exact picture. Of course, the third one sitting in the baby sitting in here is definitely not the physical baby. It is my clinic, which is Agnihealthcare, or my company, what I say, or my work, everything. And don't imagine I do everything single-handedly. I have a very good husband. We share our responsibilities equally. I didn't get a family picture of both sharing. That depicts exactly my position at the moment. So how did I change into there? I came to UK. I was being very lucky with quite a few things, because I have to say one few things I'm very lucky is I've got very good parents. I've got very good teachers, good friends, good husband and kids. And also I've been very lucky in getting my first ever job. That I have to admit that. I just visited Middlesex University's Ayurveda department. I never knew that they were looking for somebody. And Dr. Atik, who was head of the Ayurveda education at that time, he actually literally offered me the job straight away. This is the payment option available when you join. Are you happy with that? Because I had a bit longer commute. So he clearly asked, are you happy with that? Who will say no? Just imagine, kids. I came from a small village just like you. I come here, I finished my MD. I was just visiting one of the top 10 universities in the world. And I was thinking, I wanted to ask how to apply, and they give you a job offer. Who says no? Whatever. I was thinking inside, whatever the amount they are saying, that's nothing matters. I'm getting the first job in the Middlesex University. That matters. That was my thinking at that time. But when I started journey there, everything started changing. From there, I learned a lot. Not only from my teachers, you always learn, because we in the teaching profession always say that it's not only your teachers, your students also teach you quite a lot of things. You will keep on learning, looking at the students. I have to say, where I am shaped in the professional life, I have to give a big, big chunk to my students also. I learned quite a lot from them. And the first and foremost thing I learned is age never matters. I'm telling you guys now, because age never matters. And most of my students who come here to study, to do the MSc Ayurveda, they are already have a career. They might be in some are in the law, some are in the medicine itself, some are in somewhere in the like the marketing. somewhere in the software field, different field, and they had a career. And at some point of time, they realized that they wanted to study Ayurveda as a additional. They wanted to do MSc in that. Listen, to do the MSc, you need 5 years of your life to be dedicated that. They'll take a career break or they'll take a part-time break. They'll do the course as a part-time. This actually changed a big thing in thinking in me. It's a big thinking shift. I'm telling you guys also. Once you finish something, you might not be able to achieve your goal. Don't say that I can't do it. I'll able to do. Never ever able to do it. You can restart from where you left anytime. Of course, sometimes we'll have the responsibility, or you might end up in a thing which you think it's good for you, and halfway through you think my interest is somewhere else. But finish that thing, whatever you have started studying, finish that, have a little bit of career, have a stability, then you can jump into or have a kind of a part-time career and the kind of things like that. And another thing we have to remember that it's a working atmosphere is entirely different. I was really, really surprised to see. I still remember one of our students who was breastfeeding mom. She used to get her child to the class. When she was sitting in a 2 hours long lectures, her husband used to look after the child outside. And every break, she used to go and feed the child. And everybody is so supportive of her. That actually changed my thinking that, okay, I can continue to do working whenever, even after having the kids. Of course, I took 3 long breaks. One was because of a misfortune. I had a little bit of health issue. And then other 2 for the maternity breaks. But every time I had a maternity break, I could come back easily. And I have to tell you so many times, still today, my daughter, if I'm online, she comes sometimes and she shows her face. It's fine. It's fine with my students, and they won't complain. That they know that when the kids are young, they do need the mother, and it's very difficult for them to see that mother is at home and they can't talk to them. And when she was really young, she used to come, she used to show her face and just give a cuddle and go off. And this thing actually helps you to continue working. Remember, this is very important in the post-COVID era. We might go for the work from home quite a lot. Remember that. So this one point is actually a benefit especially for the girls. When you are at home and you are a young mom, also you can multitask. That's one more thing. And yes, where did I reach then? I started going out. I went out of the UK after having 2 kids just for the conference. I got an opportunity there. Then I started going out once a year, twice a year, like that. Now I go out of UK to the Europe every monthly once, pre-COVID. Okay, that's how you can expand. That's what I wanted to tell you. If you are interested in Ayurveda, remember West is picking up on Ayurveda quite a lot. And there is a lot of interest, and people want to follow Ayurveda in depth also. Both they want to learn and they want to follow. If so many patients I have seen, they have done short courses in Ayurveda just to understand what is Ayurveda. That's something we as Indians, we have to know that. We have to put our efforts. Actually, Achala has used a really good shlokas for the Ayurveda to explain the Ayurveda. Yes, Ayurveda has a lot of. It is a glorious science. It had its golden era before, and what I am seeing is in my career of last 20 years nearly in Ayurveda, I can say that I have seen a big drastic change in the people how they consider Ayurveda, especially in the West in last 14 years. They used to ask me. I say this thing everywhere I go to, even to when I go to talk to BMS students. Remember, they used to ask, "Are you what?" I used to say, "I am nothing. I am a girl, lady. That's all." They don't know. They can't. There used to be days they can't pronounce Ayurveda, and now they come asking that I looked into your qualification. You have got a MD in Ayurveda, and which subject you have got MD in Ayurveda? What diseases you can handle? Do you understand? Where did you train? All these questions. This is all Westerners. I'm not talking about the people from the Indian origin. Okay, so that's how the people are understanding Ayurveda, and they are opening up for the Ayurveda. So this is a little bit about how I changed from a simple village girl. And for the chat questions, I will answer the question by the end of the talk. Is that okay with you guys? Hope that's fine. Yeah, this is what I want to say, that how it is very important to keep on hard working and the persistency in what you are working. Of course, last year I applied for the clinical research post graduation course from the Harvard Medical School in the Boston. Of course, we had lessons in the UK. That's the reason I applied for that. I got selected 1 year. Again, I did a really hard work, and hard work pays off at the end. When I got the certificate, of course, this is one of the best university for the medicine you can get into. That was my goal. I achieved that. This year, I will keep a different goal. That's how I would suggest. Keep a different goal. Once you achieve one thing, yes, done. Don't keep there. Keep a different goal. The same thing when we are looking after, I'm saying if you want to do anything else, like if you are in the software field also, once you achieve something, keep a further goal. So that you will be able to keep on getting a better you out of yourself. That's very important. That is the success, I feel. It is not the money, it is not the what you have achieved, it is your mental peace and feeling of accomplishment. That's what you have to look for. Let's come back to the Ayurveda now. Now I'm going to the topic. So, what are the career options in Ayurveda? Do you know WHO gives some of the guidelines of what to do, what are the how to be, and what are the way to practice Ayurveda, all these things. In that, they give a Vidya or the Ayurveda doctor for them, and a little bit about the researching. And there are other things like nursing, pharmacist, and Ayurveda coach. Who, of course, to be a researcher, you have to finish the BMS, be Ayurveda doctor, then go to that line. So what is this nursing, pharmacist, and the Ayurveda coach? These are something different, but you can see that in the Ayurveda colleges nowadays in India. That is, if you have done a nursing course, you are interested in the nursing, you finished the nursing, and you want to take up the jobs in Ayurveda hospitals, or you want to have an inclination towards the Ayurveda treatments and help the patients going through that. So there are the short courses which are a post-graduation after the nursing diploma or a nursing BSc for Ayurveda nursing. Okay, that gets you into a more in-depth knowledge of the Ayurveda, how to look after the patients who are going through the Ayurveda treatment along with whatever the other medicines they are taking. Okay, and next is the Ayurveda pharmacist. I think there are some of the universities are getting the courses there. They might start from the PUC. I'm not sure about this because there were the talks, and I haven't followed it exactly. I can, if you are interested, I can follow it and come back to you. Of course, there are, once you've been a pharmacist, there are the short courses like postgraduate diplomas on how to be an Ayurveda pharmacist, because again, the Ayurvedic formulations and all these things work entirely different way, and how to understand that. That's why. And what is this Ayurveda coach? Listen, this coaching is a big thing in the West nowadays. I have seen that in India also it is started. So coach is a person who guides you. So Ayurveda coach is a person who guides you through your Ayurveda health journey. Okay, so I have seen some of people who have done the BMS in the West. They are also getting a short coach degree just for the reason that they can authentically say themselves they be member of their organizations in the coaching industry. This coaching work many of us do because it's just giving a guidelines. And being an Ayurveda coach, as per my knowledge, there is no courses available inside India at the moment. But some point of time, definitely they will start, I'm sure, because of the demanding of the people. Once they open it for the Westerners coming to learn, and they will also open it for the Indians inside. So anybody who wanted to do Ayurveda couldn't do because of something, but they have got a limited time in their hand, they can think of this. Where you will be helping somebody with their nutrition and lifestyle. That's all you will be able to do. But that's also, if you wanted to be in touch with Ayurveda, but your subject is completely different, then that's a good option. Okay. Of course, you do BMS, you write the entrance exam, get into the BMS. I'll go a little bit deep into what's next after the BMS. So, of course, you look for different colleges, and I think the Indian top 10 colleges are announced by the CCRAS. And fortunately, in Karnataka, I think 3 of them are there in Karnataka. And depending on your marks, you can get into them. And I would suggest whichever the college you go, there are quite a lot of good teachers around Karnataka. Karnataka, usually for Ayurveda studies, Karnataka, Kerala, and Maharashtra are really good. They have got very good teachers and a steady method of the learning also. And if you go to the central universities like BHU and now the IIM Delhi and Jamnagar, you will see that if you are studied in Karnataka, you really get a good what's that? The people will recognize you more. The teachers in the first beginning itself, they'll say that, okay, that's really good to know you're from there, and they expect a lot more from you. Remember, from the people from the other states, because you have the core teaching here. And another place to study Ayurveda the best is the Gujarat. And I can see that even in the UK and Europe, I do run a small charity for us, like for only the Ayurveda professionals. We, along with my friends, we see that many who are trained in India only come from 3 states. Of course, some from Kerala, that's the 4th state. The maximum from Karnataka, Maharashtra, and Gujarat, and some from Kerala. Whereas the people from the Kerala, they are more in the India and the Middle East. All the other 3 states are everywhere in the world as we sparsely go different places. But you can clearly see the knowledge you have that makes you what you are in the clinics. So what's after BMS? You got into BMS, you studied well. What's after BMS? You can think, depending on your responsibility. One, you can put your clinic and start practicing. It doesn't mean that you've just done the BMS, you can't do a good practice. You definitely can do good practice. Quite a lot of my friends are doing really well just after the BMS because their core understanding of Ayurveda is really good. That's one option. The second option, of course, someone told me, and of course, many think that for the girls, you'll get married. Remember, once you get married, that is not the end of the career, and there is no notion like that. Of course, in our era, it was like that. But if you are in the professional thing, at least when you have at least when up to you have kids, you try to go on working. I agree, and. Of course, even after the marriage, you can study MD. That's another thing. When you are doing MD, you have to really think which is your favorite subjects, which you think you can work really interestedly in depth, rather than just getting. I want to do an MD. I got this seat. I will go here. Please don't do that, because what will happen is your interest is completely in a different subject, and you get into different subject because that's what you got, or that gets you into a better job. But what happens is you can't give you 100% and you can't achieve what you want to achieve out of it. That's one suggestion I have for the people who are doing the MD. Of course, after MD, what are you going to do? Many join some colleges and get into that area, and some write the UPSC, get into the different government organizations which need Ayurvedic doctors in them. And then there is one more thing, you can get into clinical research. Either after BAMS, you can get into that, or you can do it after the MD. And especially if you do MD in certain subjects like Dravya Guna, that is comes as the pharmacology of Ayurveda, or the pharmacy of Ayurveda, Vaishadhya Kalpana. In those subjects, you can get into R&D. If you're interested in the research, that's another way to get drug research, especially R&D departments are open for you there. And you can look into the outside world, and there are some very good business models you can think of, especially inside India. I'm just talking about inside India. There are some people like Rishikesh Tamble, or even you can look into the Dr. Kajay, his business model. They are really good business models. Rishikesh Tamble, where he has completely got into the research and getting the products, really good products, through his pharmacy, and that is going around the globe. That's what you can achieve on it if you are interested in the medicine production. And if you are interested in just practicing, look at Dr. Kajay. I think you all know who is Dr. Kajay now, because of the whole thing happened during the COVID. He runs a good clinic, and also his clinics have franchises. That's another thing. If you have a strong base, there will be people. There are a lot of patients which you can't give 100%. Then you can have people coming and working under you, learning and treating your patients with that way. Okay, and even though he's just has a clinic, he never left thinking of the research. That's another way of the looking at it. This is inside India. Outside India, yes, there are a lot of options. Again, what do you want to do? I know some of my juniors or the friends, they got into the spa degrees, and because their interest is in the spa, they started doing the spa. Whereas for me, Ayurveda is a medical science, has to be practiced as a medical science. That is my kind of a firm, rigid thinking. So that I stick to this. That's what I stick to this. But you can do quite a lot in the spa industry also, because Ayurveda is not just treating the disease. Remember that Ayurveda is to prevention, and also Ayurveda has got a huge amount of things on looking after your body, and also in the beauty side also there is a huge amount of things. So once you do BMS, you can choose your area and go into that. And outside India, quite a lot of people are in the spa. That is the easy way, because that's easily gets into visa. Of course, when you're coming outside India, visa is an issue, right? But here, I would suggest girls have a better chance. If you can get into a place where you can get a visa through your spouse, that's much more easy. So girls, listen, once you have really an upper hand in the career option, just think about that. I'm not saying just for BMS, it is for all other things also, all or whatever your career is. So once you visa is the biggest hurdle whenever you try outside India. So once you get the visa, you have the visa, then you can start. For example, in UK and Europe, yes, we have a lot of rules. We can't touch some of the herbs which can easily available in your corona kit. For example, let's take the COVID now. Corona kit inside the India, you have got quite a lot of really good herbo mineral products, but legally they are not allowed here in the West. So we don't have it. So, but we have all the herbs, right? So you can use your own methods. Of course, we have our own COVID kits. I will talk about it at the end. Um, but it gives you a first thing is you can look into another person who is practicing. Usually, I know there is a little bit of the lack in the support in when you start practicing in the West. I have to say that, and there is a little bit of not so regularized because in the India it is properly government has got its regulations set in force. Of course, there are quacks. I'm not saying there are no quacks in inside India. There are enough quacks, but in the West there is no regulations at all. So you have to keep. Of course, we when I started, for example, not only me, quite a few of us when we started in the West, we were had to kind of educate the patients about. We actually spent nearly 10 years of our lives diving deep into the knowledge of Ayurveda. We didn't finish the 10 days course and become Ayurveda consultant. So that's why I clearly put my MD Ayurveda properly wherever I go, because you have to understand to get into there. I have spent nearly 10 years of my valuable life and time to get there. So, of course, now quite a bit better. People understand. They ask, where did you study? What you study? All these questions. But this is one issue you might find it when you are practicing in the West. And another thing is, I said, you have to get adjusted to the herbs what are available legally inside here. Then once you get used to it, you can ask somebody who is practicing locally. Usually they will let you work with them. Some people let you do the shadowing and all those things, and you can start. Especially most of us now here, of my generation at least, we have started doing that, like a helping hand for the others who are coming as the newcomers from the India. So then you can have the clinic, and again here what kind of model you want to do, that's again left to you. Either you can have this two settings, one is completely spa, or spa and the medical, both settings together, or you can have just an individual clinic. That's what I personally do. I am an individual clinic holder where I started as an individual practitioner. Then slowly I started working with the other people. That's how my clinic started growing step by step. But you can do that way also, and where you will be renting the rooms, and it's not a lot of financial commitment. Listen, all these things you have to think of. I would suggest one more thing is, you have to, whatever you study, you have to learn about the finances, handling the finances, because in our education it is not at all there. I did MD. I had no idea of the business, how to run a business. And when I started here, I learned from scratch. Of course, now there are, because even though it's not your subject, it's something essential life skill. I would tell you guys, sometime in your life, put some effort in there, learn something in terms of the handling the different kind of finances and running an organization, all these kind of things, very, very important. That's one thing you have to remember that. These are the things you can do after the BMS. Once you go to the West, of course, teaching ability opportunity is there. As Jagadeesha Navada said, I am helping an academy called Ahimsa Academy in the Paris. I'm being the director of education there. That means I'm helping them with the 5-year courses, what we are running there for the Ayurveda, how to manage that and all those things. I'm helping there. These are the extra things I added on along with my clinic. Of course, till today I am teaching as a lecturer. That's my passion. It's that's again, you have to think sometime. What do you want to do? And that's the reason you must know what's the reason. Know the finance handling also. That's another thing. A life skill I want you to learn separately. Whether you study Ayurveda, software, or medicine, or homeopathy, naturopathy, whatever you study, you must know the finances handling very well. Okay, these are the options you have outside the West, outside the India and inside India. And then let's come back to one more thing, that is Ayurveda in the post-COVID era. So, as I've told you a little bit about what's the state of Ayurveda in the West and Ayurveda in India. Of course, in Ayurveda in India is much full-fledged compared to Ayurveda in the West. Because even though I'm trained in quite a few things, I can't do it here in the West legally because we are not allowed to. As it is not a regular, the government is not, doesn't have any regulations on the Ayurveda. That's the reason. So I have to kind of not to do certain treatments because of my specialty Panchakarma. I do crumble on the couple of very effective treatments. But that's okay. We have other things to handle. Remember, always thinking out of the box. That's what very important. And I learned this thinking out of the box, I have to say, from my high school and the PU days. So those carefree days taught me quite a lot of things. I have to say, really, thanks for the unknowingly picking up those skills. How our teachers put those skills in us, I never knew it. Now think back, okay, I picked up these skills from there. So just immerse yourself, because VJC has a good atmosphere, balance of both the studies and the extracurricular. Keep so that you are in the both the places, not in only one side. Okay, that's how you can pick up different skills. Coming to Ayurveda in the West in the post-COVID era, what we are saying is, in the post-COVID, of course, we had one set of the thing going on, and we had a little bit of post-COVID complications, patients coming in, because some of the post-COVID complications like no energy, not able to sleep, severe body ache, and loss of appetite. These look like the simple things when we say it, okay? But in the day-to-day life, you're not able to sleep. How can you perform very well? And your nose is always blocked. Your smell hasn't come back. Your taste sensation hasn't come back. And your body aches horribly. You don't know, when you wake up in the morning, you don't know which part of the body is aching, and tomorrow morning, and what you will be able to go to work or not. These are the symptoms which we are seeing quite commonly after the COVID. In the West, we have already started patients coming for that. I can clearly see that. And of course, in India, Ayurveda is doing really good for the COVID. There are quite a lot of researches are undertaken by the ICMR. And as per my knowledge, quite a few Ayurveda college hospitals have undertaken specific COVID treatment protocols also, and the post-COVID treatment protocols. They are doing really well, and the total awareness about Ayurveda has increased. And in the West now, especially in the UK, we are getting calls for us Ayurveda doctors, not our regular patients. Like, of course, they have been with us, but some people completely new, they will look for you, looking for us and calling us, asking that you guys know that the new mutant strain is highly contagious, and we are in the tier 4 regulations now in the where I am now. That means it is completely no. I have seen the people who have just gone out for the shopping to get the grocery and got the COVID from there because there's no other exposure. That's all. So we are getting the things like that. There is no, the person has got the temperature, they are COVID positive, and they're not as critical as to be hospitalized. Remember, in India, when you had it, you had a better chance. Whenever you consider you are COVID positive, you are taken to the hospital, put in the isolation. Okay. Here it is not like that. It is like you have to stay at home in the isolation. And if you are living alone, it's even difficult. Remember that. So that's the reason we are getting called. Can you reduce our temperature? Can you reduce our cough? Or can you improve our breathing using the herbs? It's not, I have to say, it might not be only for Ayurveda. The same thing might have been experienced by the Chinese herbalists also, because people are looking at these methods now. The future healthcare is not a single healthcare system, remember. It is about the integrated healthcare system. So every healthcare system has its own limitation. So for the emergencies and certain surgeries, go to allopathy, and certain chronic issues come to Ayurveda. Some things like the cancer and all these things do both the things together. And pain management, I've seen quite a lot of people doing the pain management, half Ayurveda, half acupuncture, and a little bit from the allopathy, all three together, clubbed together. So that's another thing. That's what I'm seeing here, and I think it's going to start in India also. Of course, in India, people do n number of things, and but not knowing, Ayurveda doctor doesn't know which allopathic doctor they have gone, what prescription they are on. No, it's not like that. It's all communicated between each other. That kind of thing is going to come soon. And if I'm not wrong, near in Tamil Nadu, there is a hospital which is already aimed like that, where they have the Ayurveda, naturopathy, and allopathy all in one roof, and they have got equal importance. And patient is given all the three options at once. So that is the thing what you can expect for Ayurveda in the post-COVID era. And immediate scopes of Ayurveda in the post-COVID era, we have to say that in the immediate scope, as I told you, first thing is there is the COVID, post-COVID symptoms or the complications, what we call as especially the, of course, lung scarring, all those things are the major complications, need to be handled in different way. But very few of them are like that. But most of them have these minor complications, and which needs a continuous help. And the best answer is in Ayurveda, because I've seen that by correcting their lifestyle, correcting their food, it's something very interesting. Just correcting the food. You might be thinking you're eating healthy, but that's not good for your body. Not in the right time, right proportion. You correct that, most of this go off. So that is the immediate scope, and I have to say that we are in the lockdown, but quite a lot of Ayurveda doctors in the West, as per my knowledge, their practice has been picked up in the sense they are either they are doing, some people are doing some extra free hours for the COVID patients. Some people are doing the whatever the way they can help. That's something different. Other than that, people who are practicing Ayurveda, for them also online number of patients increased, because people are thinking Ayurveda can do things. They even taking the herbs and the food and lifestyle do a drastic change in them. That's why they are coming more and more. Of course, it is not going to stop once the COVID is stopped. Remember, it is going to continue. It's like once you have the faith, you're going to continue it. So definitely there is a better future for Ayurveda both in India and outside India. You have any questions on it? I think I've taken a little bit extra time, nearly an hour. Sorry for that. Any questions on this? I'll stop here. I can see that. And thanks a lot to Jagdish Navada sir, because I have to say that it's a pleasure. It's really pleasure.
Thank you.
Do you
Thank
know
you.
what? I can connect with you guys a lot. It's like me how I was 25 years ago. So that makes a kind of a really it's a very pleasure to be with you guys. I'm open for all the questions now.
Thank you. Thank you, Dr. Prathima. Students, if you have any doubts, you can ask. So even in Kannada also, no problem.
Yeah, ಹೌದು. ಯಾ ಕಾಮರ್ಸ್ ಐ ಥಿಂಕ್ ಇಲ್ಲ, ನೀವೇ ಸೈನ್ಸ್ ತಗೊಂಡು ಎಂಟ್ರೆನ್ಸ್ ಬರೀಬೇಕು ಆಯುರ್ವೇದಕ್ಕೆ. ಫಾರ್ Rashmikala's question, I took commerce in PUC. How can I, ma'am? As per my knowledge, you have to do you have to take science and do an entrance for that. Same way like the CET. I think now ella one day entrance, isn't it, nowadays, sir?
Yes, ಹೌದು.
Is
Need
yeah
to.
yeah. Okay, is BMS harder than MBBS? That's how you take it. That's why it is a bit harder. I would suggest. Yake, the reason is you have a listen. Ayurveda has a strong hold of philosophy also, and you have studied science, okay? And the Western science is anatomy based. Remember that the allopathy is more anatomy based. So when you go there, your biology, whatever you have learned, is directly helps you there. So Ayurveda is more physiology based, and the teaching, it starts as you will have anatomy, physiology, both Western and Ayurveda combined there, and you have some philosophical backgrounds and Samskrita. If you don't know Samskrita, of course, in Ayurveda college they teach Samskrita properly, but you have the basic knowledge of Samskrita that helps a little bit. And philosophy no hange ಸ್ವಲ್ಪ ಅಭ್ಯಾಸ ಇದ್ರೆ okay. Otherwise also you can pick it up if you are interested. Remember, nothing is difficult. If you are don't have interest, it is going to be difficult. Ayurveda, according to me, it requires a little bit in-depth knowledge. If you are studying in the places like SDM Udupi, the HM college in the Udyavara, like there where I studied, I have to say, most of the colleges in our area is like that. They make you study both the systems quite in depth to understand. So you have to be ready to go through that. Does Ayurveda have a better solution in curing cancer than allopathy? Remember, cancer is a disease which comes as a asadhya vyadi in Ayurveda. Asadhya antandre, you know, the same Kannada mate Sanskrita has the same meaning, right? So we are actually trying to give the better days for the patient as long as possible. But I won't say something has a better solution because it had to be looked at it. We don't have the numbers for that, enough numbers for that. But ಎರಡು ಒಟ್ಟಿಗೆ ಯೂಸ್ ಮಾಡೋದಿದೆಯಲ್ಲ, with the coordination, right kind of coordination, it's definitely makes the life much, much better for the patient. That I can say. And I never said to patients to stop the chemo, radio, or the surgery, whichever is required. But work along with that. That makes a big difference in the recovery road, and also helps in the prevention of the secondaries. Ayurveda, I have seen that. That I can say with my thing. Yeah, how did you get interest in Ayurveda? It's a big question. I have a little bit of a background, kids. Okay, I belong to family of Girkemata Adiga's family. So ನಿಮ್ಗೆಲ್ಲ ಗೊತ್ತಾ ಇದೆ, ನಮ್ಮ ಮನೆಯಲ್ಲಿ ಜ್ಯೋತಿಷ್ಯ ಆಯುರ್ವೇದ ಎರಡು ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಇದೆ. So I was interested in Ayurveda like that. I was interested in the medicine, to be honest, in the beginning. But when I was in high school, I think, yeah, I had a severe allergic bronchitis to the extent that of course, ನಾನು high school teach ಮಾಡಿದವ್ರು ಯಾರು ಇಲ್ಲ except Shripati Heller, I think. Uh, all of them know that I'll go to school in eighth middle shuruvagidadu. So I'll go to school for 15 days, then catch something. I'll get a severe allergic bronchitis and stay at home for a week or something, then come back 15 days, then again. That's what happened in the 8th standard. And every time I take antibiotic, I'll be better, but it's not gone completely. Then I took Ayurveda and I was fine. Of course, I followed everything. I have to say that they made me not to play outside because it's dust was one of the triggering factors. So 8th and 9th, I didn't play outside. It was as a child, I didn't like it, but I followed it for somehow, and I took Ayurveda medicines. I got better. That kindled my interest more into Ayurveda. Then I felt, okay, there is something which doesn't have answer in the allopathy has in Ayurveda. I want to explore this. That's where I got into it bit into deeper, and my background, family background, on actually helped me a lot into get into that more and more. That I have to say. Relating to microbiology and Ayurveda in the R&D field and career option in the future. Yes, it will definitely start because what I'm seeing is we are getting in the West students. As I told you, here you can study anytime. That's the much more prominent in the West. That idea is so. We are getting students who are microbiologists, biochemists. They are studying Ayurveda and applying it how to do in their field, and that is the future. I really feel because as per my knowledge, I know somebody who was approached by a set of microbiologists regarding Ayurveda for especially during this COVID era, what Ayurveda thinks of the virus and all these things. Okay. Definitely in the future there is. Yes, there are few people put their hands up. I don't know what's your arrangement, Jagadeesha. Any questions? I think somebody put the hands up other than the Jagdish nowadays, sir. I don't know. And did I miss any questions also? That's another thing. Okay, that's fine. Technical assisted Ayurveda studies in the meaning. What do you mean by that? I didn't understand that. Are you're asking about the research side, like a microbiology, biochemistry, R&D, that side, or are you asking about the regular? What is the procedure? Yes, listen, we use everything. I have to say that because that's another thing I always feel that's a biggest positive point for me is I studied in the really good institutes for Ayurveda. I have to say that because our teachers taught us like if a patient comes with a scanning report, what do you think of that in Ayurvedic way? So there are, of course, now more and more people. Of course, we quite a lot of us understood at that time, and we teach our students. So quite a lot of people do that, and Yes, the newer technology, and I always believe that radiology is completely physics. When you look into the physics, it's the mechanism of most of the investigations is in the physics, and anesthesia is more to do with the chemistry. Has a quite a lot of um, uh, hand in there, those things, and like that we do use all the technical help in terms of the technical advances in terms of the medical field, I have to say that. And yes, because once you study Ayurveda, you know that how to understand, because it might be too much if I start explaining you how to understand that and all those things, I feel. And if you have further questions, who is that? Shri Krishna Kedlaya. You can message me and I will answer you in detail what's the particular questions. And according to the researchers, when we do the research or the things, yes, you can. We use all the regular lab data to show that it is the disease is got better and it's cured, all these things. Yes, Vidatri, you can practice gynecology in Ayurveda. It's a very properly developed phase. And of course, inside India, you can do the deliveries, and you can, of course, if you're trained in some places, you can even do the C sections, depending on where you get your MS degree. All those kind of things are there. It's much more well advanced inside India. Outside India, also, it's possible. I have got quite a lot of my friends practicing only in the gynecology in the West also. They have got really good practice. Um, of course, in the West, you can't be performing the delivery, but you can be with them, take them through all the other medications and the things like that. Yes, diabetes is a lifestyle disease. So, do we have a permanent treatment for diabetes? That changes from person to person. Okay. The reason is diabetes is called lifestyle disorder. And listen, I'll give you a little bit of a history of the diabetes thinking of it. If you read Raghuvamsha, um, in there they say for the king what happens is he doesn't have the kids. So what rishis tell him to do is, or the Vaidya and the rishis together tell him to do, is to look after the daughter of Kamadhenu. ಆ ದನದಿಂದ ಅವ್ನು ಇಡೀ ದಿನ ತಿರುಗ್ಬೇಕು, ಅವನು ಅವನ ಹೆಂಡತಿ. They have to eat what they can forage ಅಲ್ಲಿ. It's not that they can ಮನೆಯಿಂದ ಅರಮನೆಯಿಂದ ಫುಡ್ ಬರುತ್ತೆ ಅಂತ. They have to live like that for a month or 48 days, something like that. Then their infertility got cured. That's also the same thing. And then in the Sushruta, he says, if you don't have enough things, how to do for the diabetes is, you have to look after the cow, you have to walk a lot, you have to look into what you are eating. All these things he gives a nice explanation, and that's why it is a lifestyle disease. So it changes from person to person, and what they eat, how much exercise you do, that makes a big difference. If you sit always, don't do enough exercise, definitely. Remember, even in the home, we don't have to worry that much. Because nowadays we have got machine for everything. Otherwise, before, housewives had a lot of work. So housewife itself is a career in once upon a time. You don't have any free time at all, because there's a lot of work to be done, physical work. Now it's not that. Definitely, when you sit, eat, and not do enough work to ತಿಂದಿದ್ದು ಕರಗಿಸ್ಬೇಕು ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ಬೇಕು ಅಂತಂದ್ರೆ. That's the way. You have to burn the calories, whatever you have eaten. That is the answer for the diabetes or preventing the diabetes. So once you have diabetes, where you are in the disease, that makes it how much you can go back and how much you can't go back. So it is a very general question. That's why I said it changes from person to person or the patient to patient, obviously. Oh, another one more thing. There is a way of talking which is different in India and outside. If it was me in India, I would have answered yes, Ayurveda can cure diabetes. But then I would have explained this. But in the West, you have to say everything a little bit more clearer. That's why I said it changes from person to person. The person you are asking, if they are in the beginning of the diabetes, willing to change their lifestyle and the way how they eat and all those things, definitely they can postpone the diabetes in their life for n number of years. Okay. Any further questions?
Any questions? Otherwise, we can conclude the program. Students, if you have any questions, you can ask. Okay. Maya sir.
Yes, sir.
Good evening, everyone. Myself Prajwal, and I am here to present vote of thanks for today's webinar on behalf of our institution. I would like to thank our webinar speaker, Dr. Prathima Nagesh, for the presence and enlightening us with their knowledge. I would also like to thank our principal for arranging this wonderful program. I would like to thank the management and members of Kota Vidya Sangha, teaching staff of Viveka PU College Kota. I would also like to thank all the students who have joined this wonderful program. Thank you, one and all.
Yes, very nice program. Nice talk. Shared a lot of information. She has spent a lot of time with us. And once again, we, Viveka Institution, invite you and your team, that means your batch, so to visit your institution when time permits.
Sure, sure.
Yeah.
Yeah, we are waiting for the borders to open and everything to be normal.
Yeah. Thank you. Thank you.
Yeah. I have to say that I always say Viveka played a huge role in the shaping what I am. And especially when I hear that anywhere we go and public speaking skills are really good, I have to say that other than my parents, if anybody has helped is in the Viveka teachers. I have to say that. Looking at what I have, the ability and picking that up, that's for the real teachers' qualities. I'm lucky to have few of the good teachers like that.
Thank you so much. Okay. Shall we wind up the program? Okay.